It's now 10:30, so I'm going to keep to strict radio time. This is the first of a series of long webinars that we plan to host over the next 3 years. And it is an initiative of SFA Global, which includes Carlos Vélez Ibañez and Judith Freidenberg and Robyn Eversole, who will join us. I think if anyone's got their microphone on, would you mind muting yourself for this purpose? So the idea is to be having these webinars and hopefully other interim webinars, and in other ways build up a network of people who work in the area of applied anthropology or who are interested in the way that anthropology might be applied from around the world. And that, of course, involves people either staying up late, like Robyn and me, or getting up phenomenally early, like Nancy and Carlos, but in the interests of making sure as many people as possible can attend. So the first thing I would like to do is to invite Judith Freidenberg from SFA Global and University of Maryland, who is in Buenos Aires at present, to just say a few words about the Society for Applied Anthropology initiative. Judith.
Thank you, and hello from Buenos Aires, Argentina. I'm Judith Freidenberg, and I welcome you all on behalf of SFA Global. Your participation today clearly shows the interest of applied anthropologists all over the world in urgent and current issues. To start, let me congratulate you on the publication of Viral Loads, Anthropologies of Urgency in the Time of COVID-19. And I also want to thank you, University College of London, for providing us open access to this important book. I think it's particularly important to appear now, the book, because it will contribute to us continuing on a global and enhancing a global discussion of local responses to the pandemic, which is by definition global. It will also be a welcome addition to teaching, very welcome. But a bit on SFA Global. As the pandemic hit in 2020, forcing the Society for Applied Anthropology to cancel its annual meeting in Albuquerque, Lenore, Manderson, Robyn Eversole, Carlos Vélez Ibañez, and myself started conversations on how the pandemic reinforced our global interconnection. The four of us are members of the Society for Applied Anthropology, an international society for the applied social sciences. We presented different ideas regarding internationalization to this professional organization, and particularly the idea that in the face of disruption and uncertainty, the forced turn to virtual communication represented an enormous opportunity to expand and strengthen our engagement with colleagues all around the world. We argued that global engagement of applied social scientists was needed more than ever, as a range of urgent and important challenges faced peoples and communities around the world. These ideas, which were welcomed by the SFA, led us to found SFA Global. And we proposed 3 aims for global SFA. 1, to promote networking and dialogue among applied social scientists around the world. 2, to bring together local knowledge and perspectives on emerging global issues. And 3, to develop comparative frameworks for equitable cross-national collaborations. So SFA Global started organizing activities to address these aims. And one of them is the hosting of webinars that can promote dialogue, collaboration, and learning from one another. We have planned a series of webinars from 2021 to 2024. Today's event on COVID and precarity is the first of 3 webinars organized by SFA Global to showcase the possibility of collaboration across borders. The second webinar, planned for 2022, will be on community engagement, collaboration, and engagement. And the third webinar, planned for 2024, will be on migration. In the chat, you will find links taking you to SFA Global and also to the next SFA meeting. So we hope that today's event will lead you to join SFA Global and to participate in the upcoming SFA annual meeting. Thank you. Lenore.
You're on mute. Lenore, you're on mute.
I am on mute, thank you. My apologies. Can I just welcome everybody who's now joined us? And I see that there are at this stage already 105 people present, and it's wonderful to have this many people joining us. What we're going to be doing today is to talk through the themes that the book Viral Loads has brought up. And what I and others are going to do is to pose 5 general questions and provide you with opportunities to comment throughout. So we'll be posing questions to individual authors, many of whom are speaking also on behalf of their co-authors. And then at the end of about 20 minutes, we'll have 10 minutes of discussion, another 20 minutes, another 10, another 20 and 10, and so on, with a bio break, just so that you know that that will be coming up at one point. If you want to speak, the best thing is probably to put a note into the chat box, and Carlos, Judy and Robyn will be monitoring the chat box and pulling out questions, and they are charged with running those question and answer sessions. So the first thing that I want to do is to reflect that under the conditions of any pandemic, the state swings in order to contain transmission, to manage infection, and, as we are well aware from last year, to gear up health services with concern that they will be overwhelmed. So within days of the declaration of COVID-19 as a pandemic, countries around the world were in lockdown and other services were deferred or they were streamlined as resources were shifted to manage the pandemic. One of the people who co-edited Viral Loads is Nancy Burke, and Nancy is in California. Nancy, let me start with you. Can you tell us a little bit about what happened in Cuba?
Sure, thank you so much. I'm so excited to be here with all of you. So in the case of Cuba, I think the important thing to think about is that there were multiple states at play. Right. First was a Cuban state, which launched a rapid and comprehensive multi-sectoral response in January 2020, before many other nations were even paying attention to what was happening. And this response built upon their public health infrastructure, which includes an expansive health professional workforce that had great experience with prior epidemics, including dengue, HIV, and Ebola. But the second state that's very, very present is the United States, whose government, under the leadership of then President Donald Trump, reinforced draconian efforts of the Helms-Burton Act, which left the island running at 50% of needed fuel, cut off largely from external trade, and in the midst of a financial and health crisis. So on the island, the pandemic was both a health and economic crisis, and the two were functioning hand in hand. And the presence of the paternalistic effects of both the Cuban state in its response, as well as the United States in its continued efforts to isolate Cuba, were ever present. So just as an example of the rapid response, in January 2020, deans from the island's 13 medical schools put out a call for volunteers, and over 28,000 students responded. And so these students worked with physicians on the island to initiate a rapid screening throughout the island, which had an incredible effect on pandemic control. So that, coupled with the sort of reinstantiation of the National Police Force to enforce the public health mandates, created a kind of an interesting confluence. So, for example, the National Police Force enforced quarantine at the individual and community level. So you could not move between provinces on the island. People were fined for not wearing masks. You weren't allowed to drink alcohol in public. Lots of, sort of incursions into public space. At the same time, the state was sending physicians around the world to support pandemic response, right? So the Cuban doctors were the first to arrive in Wuhan, China. And in the midst of the first wave, they were working in 18 countries. And now they're making their vaccines, the Abdala and Soberana vaccines, available throughout the global South when countries like the United States are not. So despite the effectiveness of this initial response, the numbers in October were really low comparatively, particularly with similarly sized nations. Because of the economic crisis, they were no longer able to keep their borders closed and opened up to tourism again. Now, the first cases in Cuba in March of 2020 were brought in by Italian tourists. And so they opened up again in November 2020, and the cases have been rising ever since. In the midst of the pandemic, they also underwent a currency conversion. And
running out of time.
Okay, sorry. So the combination of this state of control and mobilizing the public health infrastructure and the US state reinforcing its powerful diplomatic restrictions has left people on the island suffering. And as of today, there are over 800,000 cases and almost 7,000 deaths. And the number of children that are affected is rising. Sorry for going over. Thank you.
Sorry, people are going to get very tired of us telling each other we're running out of time. Susan Levine is in South Africa, and Susan and I worked through the last 18 months on questions of COVID in that country. Susan, can you come in on this and talk a little bit more about militarization and exclusion, please? You're muted.
You're muted, Susan.
There we go. Let that not count for my 20 seconds. Thanks, Lenore. It's been a real privilege to be here. Thank you, everyone. On the 22nd of April, 2020, 73,180 regular, reserve, and auxiliary personnel of the South African National Defence Force were deployed for 9 weeks until 26th of June in an operation that cost approximately 4.5 billion rand. But even before the decision to deploy militia to survey the most marginal of populations in South Africa, those excluded from basic services including sanitation, running water, adequate health and childcare, anecdotal accounts of unnecessary and at times gratuitous use of force and police brutality were emerging. Troops dressed in army fatigues, in military formation, weapons at the ready, descended on townships to disperse residents and enforce, importantly, shelter in place. Local municipalities commissioned armored personal carriers called Caspers and Biffles and Hippos. Those are the names of tanks that were used to repress Black populations under apartheid, to round people up without homes and reinforce lockdown. By late April, armed soldiers, municipal police, private security forces, and even including national park rangers were being deployed to fight the virus by fighting the most at risk of infection. At a time when fear was already palpable, fear of job loss, of looting, of illness and death, and the deepening of poverty, the war on COVID-19 was claimed to be one of the largest army deployments in the country's history. Consistent eyewitness accounts and reports of police brutality and abuse went beyond the levels of violence already endemic that mimic the enforcement of law as applied to race and place under apartheid. The muscle memory of militia deployment and the unapologetic abuse of police power signals the distinct failure of South Africa's democratic transition to upturn the ghosts of apartheid and intensified an already lethal landscape of inequality. The outsourcing of militarized forces to ensure public health compliance rather than to social or healthcare workers centralized state power and consolidated the uneven distribution of force along the lines of class and race. Likewise, it deepened fear in the social context of collective grief, loss, and growing hunger and unemployment. With its specific history of militarization, the response to COVID-19 was remarkably, if not uncomfortably accommodated. The mass use of surveillance technologies to enforce COVID-19 lockdown regulations and curfews in South Africa, as elsewhere, seem largely to have been tolerated to a far greater extent than might have been anticipated, with limited capacity to oppose these measures when set against the immediate threat of viral invasion and its effect on human lives.
Thank you.
So, oh, there we go. And one last passage, that's all right. There you go, that's the military.
It was, thank you. Ella, welcome from Slovakia. I wonder if you could talk a little bit about the different reactions from and to the state and its efforts to contain coronavirus, drawing on your work in the US, Ireland and Poland, which I know you did with E.J. Sobo.
Yes. So together with Elisa Sobo, we were trying to understand how local conditions shaped people's reactions to the state efforts to control disease. And in particular, we were looking what role conspiracy theories played in that process. And what we found out is that even though on the surface, conspiracy theories seem to be preoccupied with medical facts, in fact, they were very much more about values and worldviews. And if they are about values and worldviews, then they will mean different things for different people in different locations. So a typical question that was on lips of many of conspiratorial believers or people who endorse those theories, engage with them, which is, why government is lying to us, what is the truth, had a different meaning for people in different locations. So for instance, in the United States, we have to understand that when COVID hit, it hit at the time when the American myth of American prosperity and American dream was crumbling. So then the answer to that question of why the government is lying to us was resonating with that situation. So the idea was there that the government is hiding the truth in order to push the last step in this process of killing American dream in order to gain on prosperity. So here, COVID was the restrictions were seen as the ultimate step in killing American dream and working against American people. In Ireland, the same claim that the government is lying to us should be understood in a very specific local context, as COVID hit at the time of local elections. And I think my internet is gone. Oh, it's back. Okay. So in Ireland, because the COVID hit at the time of the elections, the government continued to be in power, even though the elections results showed that it should step down. So there was a suspicion that COVID is just a plot to allow people stay in power. In Poland, there were exactly the same claims made that the government is lying to us, also because there were elections. And people who were in the opposition to the ruling party were saying that government is downplaying the numbers, is not taking COVID seriously, it's plotting to and downplaying the disease so that it can stay in power and push elections forward. And even though those tropes and those narratives had conspiratorial characteristics, interestingly, they were never labeled as conspiracy theories. So we can see how, and this is part of our conclusions with Elisa, that what this shows us, that conspiracy theories are quite complex field. And what is important is not only looking at conspiracy theories, but also how the label of conspiracy theories is applied. And if conspiracy theories are used so-called to defend democracy, they might get away with this biased labeling. And also conclusion was also that we tried to draw on that they are very universal. A lot of people were trying to understand through conspiracy theories what is going on, but they are at the same time very particular, and they should not be treated as one big global phenomenon, as a localized issue.
Fantastic, thank you. Abril is in Mexico, and Abril, you have a different take on this, which is the way in which the state used neoliberal ideas, I guess, of responsibility in order to shift the focus away from what the state was doing for coronavirus and onto individuals. Would you like to comment?
Yes, sure. Thank you, Lenore. Well, the first reaction of the Mexican state was denial. At the beginning of the pandemic, the president, López Obrador, declared that the virus was going to affect only the rich and not el pueblo, or the people. Ideas of a supposedly genetic strength to face the virus, or a strength linked to a mixture of mestizaje, circulated in the media and across governmental circles, along with an assumed advantage given by the country's warm and beautiful weather. However, this optimism was soon shattered by the rapid increase in confirmed cases and fatalities. Today, we have had more than 207,000 deaths due to COVID-19. And contrary to what the president stated at the beginning, the impact of the virus has been felt disproportionately among indigenous people and those that live under poverty and extreme poverty. So I'm going to share an image just right now. Can you see it? Can you see that?
It's coming, it's not yet, but I'm assuming it's yes, thank you.
Okay, great. So with the rocketing numbers of deaths came the blame. Medical findings on COVID comorbidities, especially obesity, became the central stage of the state discourse surrounding the pandemic. As the public started to question the government for its failed strategy to address the virus, demanding answers for under-testing and under-reporting cases and fatalities, messages and caricatures depicting a link between fatness and the risk of COVID inundated social media and national news outlets. Unknown authors produced many of these images, but one of the most problematic one was commissioned and widely distributed by this government itself. On November 5th, 2020, the president announced a new strategy to address obesity as one of COVID's most serious comorbidities. He presented a cartoon to be distributed among 30 million households in Mexico. In the cartoon, a young thin girl educates an overweight boy about the dangers of junk food. The cartoon depicts fat children as obsessed with junk food, ignorant, and unable to control themselves. And most of all, as a burden to the national economy. COVID-19 came to consolidate Mexico as a fat-phobic country, something that is highly problematic as 7 out of 10 adults and 3 out of 10 children are currently diagnosed with overweight and obesity. This could severely increase the internalization of self-blame across the population. Fat phobia may increase people's reluctance to seek healthcare with the potential of worsening COVID-19 outcomes. A focus on individual responsibility has worked to silence the social factors behind the health problems we are facing today, and the state failures to address these problems before and after the current pandemic. The government has insisted that COVID fatalities are explained by individuals' pre-existing conditions, such as obesity, and this has worked to obscure other pre-existing conditions, such as the increasing rates of extreme poverty, violence, and the appalling state of the country health system. So I'm going to stop here, but basically this is what has been happening in Mexico.
Thank you so much. What I'm going to do now is to hand over to Robyn Eversole, who's in Burnie in Tasmania in Australia, late at night, and we do have 10 minutes for questions to any of those speakers or comments around the state. Robyn, why don't you take over?
Thanks, Lenore, and thanks to all of our speakers for such a quick and inspiring overview. Could I please ask participants, including panelists, if you've got a question or a comment for the panelists, if you could just pop it onto the chat is the easiest way. But if we have a lull in proceedings, feel free to pop up your hand if you'd like to speak. But otherwise, just pop questions directly into the chat and I'll read them out for our panelists.
While we're waiting then, because people aren't jumping in with questions yet, I wonder whether we can have a bit more from each of the speakers about how much community resistance or population resistance there was back to particular state examples that we were talking around militarization, the role of the police, the fat blaming and so on. I mean, and you know, how much of an alternative voice was there and how powerful was that?
So is that to all the people that presented? So okay, so in Mexico there was yes, there was a response, especially with this cartoon that the government was circulated. There was a group of activists and fat acceptance activists and academics that wrote a column, a paper complaining about this, but the government defend itself. And they did it again. I mean, there were a lot of people complaining about it, but they did it anyway. They just defended the fact that basically obesity was causing COVID fatalities, and they just went ahead and did it. But it did start a conversation about fat phobia that we had never seen before. So that was a good thing about that, that resistant exercise. Thank you.
Yeah, and I would just say in the Cuban case, you know, we saw protests that, you know, haven't been seen in, I think, 60 years on the island. And that was largely because of the confluence of, a failing infrastructure. I mean, people are in homes that are not set up for shelter in place, right? There's no air conditioning, there's poor airflow, and it was hot. And the state coffers were pretty empty. So when Diaz-Canel opened up these dollar stores as an attempt to bring hard currency into the country, and the shelves were full of what you couldn't get anywhere else, and you could only enter those stores if you had foreign currency, it was just like a powder keg. And I think people just kind of had enough. So there's been a great amount of response, both on the streets, but then of course the police tamped down very quickly on those protests. But then also in the blogosphere, there's a lot of conversation and resistance.
It's interesting. Thanks, Nancy. I think in the South African case, it was fascinating that the kinds of organized protests that have punctuated South Africa's history were not present. People were accommodating to some extent of the really harsh militaristic measures. And some of that had to do with, and I presume we share this history across the world, was that we'd been coming out or not even out of a very entrenched HIV/AIDS pandemic. And so with the specter of COVID raised so much fear that people were very adherent, in fact, to curfews, to lockdown, to, in cases, house arrests. But where the protest happened, and I would say this isn't as much protest, but and not even an unwillingness, but an inability. We're in those marginal spaces, in those zones of abjection, whereby, for instance, there aren't even the basic resources, flush toilets, sanitation, and people would need to leave their homes, right, after the curfew hours to go to the loo, and would then be arrested and fined and treated as a criminal for needing to, go to the toilet. So there were so many local discussions about the kinds of ways in which these curfews did not take into account the very grounding and the conditions upon which the society has been, so unevenly built over, its history. So it was those sorts of expressions of everyday necessity, of movement outside of those curfews. And of course, there was much discussion about the reappearance of the language of the curfew. Even now, there's a language of the vaccine passports. And if you know South African history, carrying a pass meant either access or not access to the city, to travel, to being recognized as a human, to being recognized as a citizen. So suddenly with the specter of curtailment of movement or exclusion from public spaces or shops because of the need to now re-carry a passport, you begin to find this really contested space around all of the infrastructure of the ways in which COVID messaging and enforcement has been meted out in a way that sounds, and again, that kind of elasticity that pulls us back to remembering curfews and passes and those kinds of things that regulated movement. So it's been quite surprising that the kind of what you're describing in one context, Nancy, it hasn't actually been the case so much in South Africa, but there are ongoing service delivery protests on the highways all through the country. And so those protests are, while they're not necessarily directly linked with COVID per se, they are about the fighting for the conditions that would make some of the regulations tenable and doable. Yeah.
Thanks for that, Susan. We've had a couple of questions pop up on the chat. So from Andrew Barker, a really interesting reflection here about language. So it's picking up, Susan, on some of the points you were making about, kind of how the language of the pass or the passbook recalls history. Andrew says an impression that he has is that the confrontational and government language, when they use language like fight and battle, has received confrontational responses from communities. But collective in it together and help each other language might get more of a collaborative response. And he asked the panel, is this an overgeneralization or is there something in that? I see some nods. Feel free to jump in, any of the panelists.
I'll just comment that that's very much a part of the Cuban approach, that, we're in it together. There were regular communications, nightly communications from the Minister of Health, and, acknowledgements of how difficult this is, particularly for Cubans who are used to engaging physically with each other regularly, and asking people to keep distance and not kiss each other hello was very difficult, but that we all had to do it together to keep the community healthy. And there are some beautiful videos of little Cuban children talking about how important it is to get vaccinated. And so, that's very much a part of, their public health approach. But in the context of the suffering that's happening because of the lack of infrastructure and the geopolitical isolation, I think there's just a friction there. So I think it's very, very complicated in each case.
Great reflection. Thanks, Nancy. We have a question from Ali in Pakistan. He's a lecturer of anthropology, and he had a question for Abril. About the stigmatization of obesity and what role was played by anthropologists or social scientists to counter the stigmatization of obesity by the Mexican government?
Well, as I said, there were a group of anthropologists and social scientists that included Mónica Moreno Figueroa from Cambridge University, but most of them were based and work in Mexico, and we did try to circulate a column, a public complaint about the government actions. It was well received, but not really widely received. It was actually a very challenging exercise to put together activists and academics. It's something that, I don't know in your experience, but it's a challenge in terms of the views and there were nutritionists and there were also anthropologists and social scientists and activists. And some of the activists didn't agree with the things that that academics perceive about obesity or health or other notions of the body and stigmatization. But at the end, we did it. There was also, when we did it, there was also a huge reaction from people that were more into public health institutes reacting to our complaint, because they were saying that we urgently need to do, that we were basically colliding with the industry, with the high caloric industry, because we were complaining about this stigmatization. So, the conversation, especially between academics, activists, and people in the public health sector, has been really tense. But yeah, I guess the role is there, and we have kind of tried to do something, but there is, another side of the spectrum, which is people in public health, that has been a little bit difficult to convince in a way. Yeah.
Right. And one final question, also for Abril, from Andrea Schumann in Yucatan, has asked, what role do you see the lack of testing and transparency has played, noting that it is estimated that there have been 10 times the official number of cases?
Yeah, I mean, I think one of the things is that I have never seen Mexico so polarized in terms of politics. I mean, I see America, and then I see Mexico, and we are in the same, I don't know if in the same place, but very similar place. People that voted for López Obrador, which is a very lefty populist president, and people from the right. And one of these discussions has been actually testing, for instance. Could we think about, the government always insisted that testing was not something that was going to work with Mexican population, because the country is enormous, and because of the, social problems that we have with inequality and poverty, that was basically something that was not going to be, even if we tested, people needed to go out and work in the street. More than 50% of our population are in the informal economy. So they needed, why do we need to do testing for if people are going to go out anyway to work, because there's just not another option. So I think it has played a really important role, but I don't know if, for a lot of people, we didn't have any other alternative the way that we're doing it in terms of testing. On the reporting, it could be linked to the way the health system is in such appalling conditions that maybe under reporting is part of that problem, that that it's something that it didn't started with this government, but it has years going on. So thank you.
Great, thanks, Abril. Apologies to the other question, because we need to move on to the next session, and I'll hand it over to Nancy, who's going to chair the next section. Thanks all.
Yes.